Hey everyone, welcome to Nursing for You RN. This channel is designed to help nursing students and future RNs to prepare with clarity and confidence. In today's session, we will go through 5 NCLEX style practice questions step by step with detailed explanations to guide your understanding. Let's begin. Alright, let's move on to the first question and see how you do. A client with a pituitary tumor has had transsphenoidal hypophysectomy. Which of the following interventions would be appropriate for this client? Place the client in a Trendelenburg position for postural drainage. Encourage cuffing and deep breathing every 2 hours. Elevate the head of the bed 30 degrees. Encourage the Valsalva maneuver for bowel movements. So for find out the answer, first we will break down the question. What they have asked. A client with a pituitary tumor has had transsphenoidal hypophysectomy. So what do you mean by transsphenoidal hypophysectomy? The hypophysectomy, which means the surgical removal of the pituitary gland, and it is also known as hypophysis. Transsphenoidal means the surgeon reaches the pituitary gland through the sphenoid sinus, which is located behind the nose. That means without opening the skull, the surgeon do the surgery of removal of the pituitary gland. So this is a quick surgery, easy surgery, but the main complication, or we have to focus on prevention of increased intracranial pressure, CSF leakage or bleeding, and we have to promote the drainage of secretions without any straining of the surgical site. So these are the main priorities of caring patients with this surgery. Again come to the options. Place the client in Trendelenburg position for postural drainage. In this position, we will keep the head end lower than the feet. So that causes increased intracranial pressure, and this may lead to bleeding or CSF leakage from the surgical site. And of course, this position is never used for any postcranial surgery. Going to the second option, cuffing and deep breathing. Cuffing increases intracranial pressure and this puts strain on the surgical site. And this is also causes bleeding or CSF leakage through the nose. So instead of cuffing, we can provide spirometry, incentive spirometry to the patient, and also deep breathing we can do, but without force. Another option is elevation of the head end 30 degree. Yeah, this is a good option. So what will happen is it will decrease the intracranial pressure, it allows venous drainage from the brain, it reduces the edema, and also it facilitates breathing. So this is the safest and most effective of post-operative positioning. Anyways, we will go for the last option, that is encourage the Valsalva maneuver. What is this maneuver? This is the straining, holding breath when pushing. And it also dramatically increases the intracranial pressure, which causes hemorrhage and disruption of the surgical site. So instead of doing this one, we can provide stool softeners to prevent straining. After analyzing all the available options, the best option is to elevate the head of the bed 30 degrees. So we have to monitor for some of the measures after transsphenoidal hypophysectomy, which are head of the bed elevated to 30 degrees, no cuffing, sneezing or straining, avoid bending forward, no tooth brushing initially. We can provide mouth care with a soft swab, and monitor for clear nasal drainage because there is a chance for CSF leakage. Moving to the second question. A patient received surgery and chemotherapy for colon cancer, completing therapy 3 months previously, and she is now in remission. At a follow-up appointment, she complains of fatigue following activity and difficulty with concentration at her weekly bridge games. Which of the following explanations could account for her symptoms? The options: One, the symptoms may be the result of anemia caused by chemotherapy. Second, the patient may be immunosuppressed. Third, the patient may be depressed. Fourth, the patient may be dehydrated. Okay, let's discuss this question. A patient had surgery and chemotherapy for colon cancer, completed therapy 3 months ago and is now in remission. This is the key line of the question. And she reports fatigue after activity, trouble concentrating at weekly bridge games. So what may be the causes of her symptoms? Our available options includes anemia caused by chemotherapy, immunosuppression, depression and dehydration. So for analyzing these symptoms and the available options, we can come to know that the answer will be the first option, anemia caused by chemotherapy. Why anemia? Because side effects of chemotherapy don't stop immediately after the treatment ends. It can be longer for months. One common complication is chemotherapy-induced anemia, and it reduces oxygen delivery to the tissues that may lead to fatigue. Why we can avoid immunosuppression, depression or dehydration? Immunosuppression causes infection risk, not fatigue or concentration problem. And depression also can cause fatigue, but this patient is in remission and she is enjoying social activities and describes the issue as activity related fatigue, not loss of interest or sadness. That's why we can avoid depression. And dehydration causes dizziness, dry mouth and low blood pressure. Here there is no evidence of all of these symptoms. That's why we selected the first option as the correct answer. The symptoms may be the result of anemia caused by chemotherapy. Question number 3. A 25-year-old male is admitted in sickle cell crisis. Which of the following intervention would be the highest priority for this client? Taking hourly blood pressures with mechanical cuff, encouraging fluid intake of at least 200 ml per hour, position in high fallers with knee gauge raised, and administering Tinolol as ordered. This question asks for the highest priority intervention with a sickle cell crisis patient. For that, we have to know that what is sickle cell crisis. This occurs when red blood cells become sickle-shaped, clumped together, and that causes blocked blood flow. And this may lead to severe pain, tissue ischemia, and potential organ damage. The important interventions to prevent further sickling and vaso-occlusion. For that, we have to keep the patient hydrated and the blood will be less viscous, and that may help to prevent sickled cells from sticking together. IV fluids and oral fluids are critical to reduce the complications. Yes, now I know you know the answer, but anyways we will see why we will avoid the other options too. Hourly BP monitoring we will avoid. Why? Because frequent cuff inflation causes restriction of the blood flow, and that may lead to sickle cell ischemia. And we will avoid high Fowler's position that may dangerously increases the sickle cell crisis because of the blood flow that is already compromised. And administering Tinolol. Why? Because sickle cell pain, there will be more pain and it is not be treated with just Tinolol. They need opioid analgesics. So the final answer is encouraging fluid intake of at least 200 ml per hour, because hydration is very important to avoid sickling of the blood. Question number 4. The home health nurse is visiting a client with autoimmune thrombocytopenic purpura. The client's platelet count currently is 80,000. It will be the most important to teach the client and family about bleeding precautions, prevention of falls, oxygen therapy, and conservation of energy. What is the keyword here? Autoimmune thrombocytopenic purpura and the current platelet count is 80,000. What you will think about this 80,000 platelet count? What is this thrombocytopenic purpura and what is the amount of 80,000 platelet count means? Yes, it is not normal. The normal platelet count is 1,50,000 to 4 lakh. And here the client's platelet is only 80,000, which means thrombocytopenia. And thrombocytopenia causes increased bleeding risk. Okay, so the nurse should teach the client and family regarding the bleeding precautions. For example, use a soft toothbrush, avoid aspirin or blood thinners, use an electronic razor instead of blades, prevent constipation and straining, report any unusual bruising, bleeding gums or blood in urine or stool. That means any activity that causes bleeding should be prevented. This is the utmost care for thrombocytopenia patient. See the options again. Bleeding precautions, prevention of falls, oxygen therapy and conservation of energy. Here the conservation of energy, fatigue is linked more to anemia, not with the thrombocytopenia, and oxygen therapy cannot do anything with clotting ability. And prevention of falls and bleeding precautions can be a confusion between both of these options, but there is a concern of fall prevention, but here the primary risk includes internal or external bleeding, so we can avoid second option also. So the correct answer is bleeding precaution. Here comes the last question in this video. A nurse is caring for a patient with acute lymphoblastic leukemia, ALL. Which of the following is the most likely age range of the patient? 3 to 10 years, 25 to 35 years, 45 to 55 years or 60 years. Let's think about the type of leukemias and the age group. Over 60 years of age, they are considered as older adult and they are most likely to develop acute myeloid leukemia or chronic leukemias. 45 to 55 years of age, they are more risky for chronic myeloid leukemia or lymphomas. And 25 to 35 years of age group are considered as young adult and they are more typical for acute myeloid leukemia. And acute lymphoblastic leukemia, ALL, is the most common childhood cancer. It occurs most frequently in children between ages of 2 to 10, with a peak incidence around 4 to 5 years of age. There is a tip, ALL, all little littles. Think about children between 3 to 10. AML, adult mostly later. Think of adult and older age group. So your answer is 3 to 10 years of age group. That's the end of today's NCLEX practice session. I hope these questions and explanations give you more clarity and confidence for your exam. Thanks for watching Nursing for You RN, where future nurses succeed. Keep studying, stay motivated, and I'll see you in the next video. Thanks for watching.